go in and get retested, because there were false positives. Long story short, after getting retested and retested and retested again, I was told, yeah, you're definitely HIV positive, So growing up, basically, from that point forward, as a young adult into a man, it was a coming to terms with, how do I want to let people know that I'm HIV positive? Do I want to let people know that I'm HIV positive? Do I want to let healthcare professionals know that I'm HIV positive? Anything and everything that touches your life, in some way is affected by it. As I grew up, I kind of came to terms with it and figured out for myself that it doesn't really matter what everybody else thinks. It matters what I think about it. I had a choice within those 10 years that I had to live. Do I want to lay down my life and, die, or do I want to do something positive? So I did, I went on with my life. I started getting an education and experiencing life, still making friends, all of that sort of thing. But other people's experiences, society's experiences hadn't caught up to where we were or where I was. So a lot of what I was experiencing in healthcare were people that it was an experience like, I don't want to really touch you because I'm not exactly sure how I'm going to contract it, but it's a possibility. So, there was a lot of standoffishness in the healthcare profession. I am now studying to be in the healthcare profession. I was in the nursing environment. And as a result of that, what I've come to find out is that there are a lot of presuppositions within healthcare that, if I'm in healthcare and you're in healthcare, there's no possibility that, I can contract anything from you. So I've had people actually put in IV lines with no gloves, no other sort of protection. And I'm like, really? Still? You got to think to yourselves, it's like, there's a reason why these protections are in place, and it's probably a good idea to follow them no matter who you are. It's been a learning experience, especially, a similar story to hers is, hearing your family say that they're afraid to be around you, doesn't matter how logical or illogical it is, it hurts to hear your mom say, I don't want to be around you. So a lot of what you experience, or a lot of the life experience that you approach a person with HIV, you're going to come into contact with people who they've experienced a significant amount of ostracization, not just by virtue of perhaps their sexual orientation, but also from their families, from their friends. It's really imperative that you be conscious of that fact. One of my best experiences after testing positive was actually meeting my first care practitioner who, no matter what, the first thing that he did when he walked into the office was reach out and give me a hug. And at a time when everybody else is saying, I don't want to touch you, it was a significant way of approaching me and making me feel comfortable, not only with my own diagnosis, but with being there in a situation where I'm already afraid. And at 41 years old, I can honestly say I've not gotten to the point where I've tested positive for AIDS, which I suppose there's a criteria around which says, your T cells have to drop to a certain level, you have to have so many concurrent opportunistic infections, and I can say that I've not gotten there. My T cells after 24 years of being positive are still above 1,000. Wow. So, and that's my story.
Guess that's me. My name's Jake. I'm HIV positive for about 14 years now. 1998 was a pretty big year for me. I found out early on in that year I was going to be a dad for the first time. Didn't really consider myself tremendously high risk. I wasn't all that promiscuous. But shortly after my now ex-wife had gone through all the testing process for being pregnant, we decided it was a good idea that I go get tested and just make sure that we were both very healthy and ready to be like great parents. And then that big shoe dropped, and I went in for testing and went back 2 weeks later to get my results. And it was at a little testing facility in Phoenix, Arizona, and I went into the office with the woman, and there was a big stack of folders with green labels, and then there were 3 folders that had red labels. She dug through all those green labels several times, and then I just felt everything leave me because she went to the other pile, and I was on top. And she said, "You're HIV positive." So after about 30 minutes of crying and getting through all that emotional stuff, she kind of told me what some of my options were and said, I wanted to see my doctor and move forward with looking at what my options were for treatment. And so I was excited about being a dad and scared about dying, really, at that time. I went and saw my primary care physician, who I had seen for just general things like getting a cold or sore throat, things like that. I really didn't have any major symptoms or anything related to HIV. I felt fine. I went and saw him and told him I tested positive for HIV. And he immediately told me I needed to first he told me I needed to start taking some really great vitamins. And lucky for me, he happened to sell his own line of vitamins at his office. So I was very fortunate there. So went home with my $200 bag of vitamins and started taking those immediately, because that's what the doctor said to do. And then he also referred me to a hematologist, and I'm not a hemophiliac. So I waited 2 months to get in to see this specialist, and I went into his office, and his first question to me was, "Why are you here?" And lucky for me, he was a little bit, I would say, more educated around HIV at that time, and he told me that I should see an infectious disease specialist or someone that actually treated patients with HIV. So it took a couple more months to get in to see that doctor. And by the time I did, the virus had really progressed quite a bit for me. For those of you that are familiar with the sort of the markers that they measure, my viral load was kind of off the charts at that time. And my CD4 count was at 8. So I virtually had no immune system, and the virus was rampant in my body. But I still felt fine. That doctor told me I'd be lucky if I lived 6 months, and he started me on a cocktail of 33 pills a day or something like that, which was a full-time job in itself, just managing the pills. And every Sunday we had a little ritual of sitting down with the tray and dividing them all up. But I didn't like that 6-month figure. I too wasn't ready to just lay down and die. I had a kid on the way. I was excited about life. I was 25 years old, and I'll let you do the math there. So I was really troubled by this provider that was telling me, his outlook for me was just get ready to die. That's not the way I was raised. That's never been my mindset. So I started looking for a new doctor while taking these medications. And lucky I did find another provider that said, no. Things are changing, and these medications are becoming much better. We're starting to see folks make a turnaround in their health care. And it went really well from there. So slowly but surely, my numbers, my viral load came down, my CD4 count started going up. I kind of plateaued at about that 200 mark, but I always wanted to have 600 T cells. That was my goal, because that's what I was told was kind of a good place to get to. So after many years of work and struggling with medications and finding the right doctor, I achieved my goal of 600 T cells last year, so I'm pretty proud of that. It's been an interesting journey, though, in terms of seeking out healthcare for me. I had a great doctor in Arizona. I decided to move back to Seattle to be close to my family. And I went through a few doctors here. One moment that sticks out a lot for me in that process was when I was sort of interviewing doctors, or doctor shopping, I guess you could say. I didn't realize that I'd experienced some facial wasting from the medications, both in my temples and in my cheeks. I just thought that was, me getting a little more definition and looking more manly. I walked in to see a doctor at one of our local clinics here, and he walked into the office and he said, "Oh my God, how long has this been going on?" I didn't realize there was anything going on, but that immediately created a huge insecurity and planted that bug in me that, there was something wrong. I had that AIDS face. That was a tough one for me. After that, I didn't really want to be in pictures. I didn't even really like the way it looked. And it took a while for me to get comfortable with that. Luckily, a couple years ago, I discovered Sculptra, went in and got some fillers, felt a lot better about myself. But the lesson that I took away from that is it's important to not just look at those numbers and that chart, but really treating each individual as a person and considering that there is going to be some emotional fallout. There's going to be those social impacts. Dating, disclosing, telling your family can be huge. And a lot of times I think that from a physician standpoint, they're really just looking to get you to that place where you're undetectable and you're healthy and everything's great. That's not always the case. Those things can also lead to depression, isolation, just general fear of talking about HIV. But I'm blessed. I have a wonderful, amazing daughter who is HIV negative, and so is my ex-wife. So that was a big fear that I carried around for a while. But after having my daughter poked and prodded for years after she was born, we're pretty sure she's negative. So
She's negative.
yeah. The real challenge came for me when I had to tell her about 5 years ago. I was so nervous to tell her because, at that age, she was in elementary school and she was wise enough to know that I went to the doctor a lot. So we got in the car and we were going to Starbucks, and I circled the block several times, working up the nerve, and I finally just spilled it. And I was waiting for the big emotional response from her, and she said, "Okay, Dad, can I go get coffee now?" That was a huge load off, and that's when I really realized that I could do something more with HIV. I was always afraid of it defining who I was, but in doing so, I also was not accepting myself. And in that moment that she accepted me, I learned to care more about myself and realized that HIV doesn't define me, but it is a big part of who I am. And that empowered me to start getting more involved in the community and actually saying it out loud, which has led me to doing things like this and to be able to speak, to meet these wonderful folks here. The one thing that troubles me a little bit is the lack of knowledge that some providers still have. And don't get me wrong, I have a wonderful doctor now. He takes the time every visit I go in. I have a list of questions, and sometimes they're the same questions from the last visit, but I want more clarification. And he always takes the time out to answer them, and that's really important to me because I feel like I'm an active part of my care and the whole process as it relates to me as an individual. But I had an interesting experience about a month ago. I went in for a consultation to have LASIK vision correction on my eyes, and the optometrist who did the initial exam got to the HIV section, and she said, "Oh, is that hereditary?" And when I was done laughing, I just had to educate her a little bit. So it's surprising to me that in this day and age, 30 plus years into this epidemic, that especially in the healthcare community, that there is still a little bit of opportunity to learn. So my job is not done. I plan to get out there and educate everyone I can. But I think it's really important. I'm glad that she asked that question so that I had an opportunity to say no. I did not get this. It's not a genetic condition. And we had a nice little conversation about HIV after that. So it's been an interesting journey. I can say, though, that I'm proud to be here today and to say that I'm HIV positive. And life is really good for me. I really value every day. And the plus side, I guess, or the positive in the positive for me is that at that age when I was diagnosed, I was, what's the term, footloose and fancy free, I guess. I was kind of young and irresponsible, and it came at a pivotal time, and it helped me to become a better person and to really take care of myself. That's kind of one of the unintended benefits is I'm healthier than most people in my family these days. I don't remember the last time I got a cold. So, and in telling my daughter, she's becoming a young little advocate herself.
She is. Mm-hmm.
She loves visiting the women at Babes Network. She loves going and seeing the folks that work at SASG, or what used to be Seattle AIDS Support Group. And though she won't admit to liking the term advocacy, she is. She'll wear her World AIDS Day t-shirt to school, and when all her friends say, oh, isn't that the disease that kills faggots? She says, no, everybody's at risk, and you should know more about HIV. And I was really proud of her about a week ago. One of her friends was sending her text messages, and somehow HIV came up. She's like, Dad, I need some statistics really quick. And so she was firing them off, and she was on cloud nine because she felt like she really had some knowledge and was empowered. So, yeah, that's kind of my story. Like Adrian, I'm going to stick to that, at least for a while. Thanks.
Hi, my name is Pat Migliore, and, or if you're feeling Italian today, Migliore. And I found out, and Jake's daughter has gone with us down to Olympia to talk to state legislators, so she's way ahead of the curve for kids her age on being an advocate, although we don't tell her she's an advocate anymore. It's not that. I found out I was HIV positive way back in 1986, so that was a very long time ago in AIDS years. And I'm realizing in any years, that's a long time ago. And I found out, after my husband found out that he was positive, and Bob found out because he was a blood donor. So he donated blood, they tested the blood, found out he was positive, and he actually had been positive for several years without knowing it, and had been donating blood throughout that time, but there had not been an HIV antibody test until then. So he got a letter from the Puget Sound Blood Center that said, Dear Mr. Migliore, you need to talk to us about something that might be a future health concern. Understatement. So Bob called up this doctor, and the doctor said, come in so we can talk, and Bob said, no, tell me what's going on. And finally, I guess Bob was more stubborn than the doctor, and the doctor said, well, you have HIV, the virus that causes AIDS. So we made an appointment to go in and see that doctor the next day. And of course, Bob said, how can that be? I want to be retested. And all those things that you would expect someone to say when they get that kind of bad news. And then I asked the doctor if I should get tested. And he said, well, we don't know if women get this or not. So that was a critical piece of information. So I did get tested. I went to Harborview to the STD clinic, and it was... I was definitely out of it in so many ways because this was just so much information hitting me at one time that I could be at risk for HIV. And I had a very good test counselor, and she drew the blood and sent it off to the lab and told me to come back in a week. And I remember I spent that week trying to prepare myself for what the results could be. And I thought I was really prepared when I went in to get them. And I walked into her office that next week, and she said, I'm not going to beat around the bush, you're positive. And all that preparation I had done, I realized, was intellectual. It was all thinking preparation, and all of my reaction was a lot further down. It was heart and gut kind of reaction, and my life exploded. It was one of those times, one of those moments in my life, and I think we all have them, where things just took a turn. And I couldn't continue down that same road that I thought I was on, but I had to make a little bit of a turn and a major readjustment. It was certainly in a time when people thought you could get HIV from doorknobs and toilet seats and mosquitoes. So it was really important to us to get accurate information, so we tried to get as much accurate information as we could, and that was by going to trusted sources and doctors and nurses in the health department, because it was pre-internet. And believe it or not, there was a time before the internet. And we got enough information to realize that this was a very bad disease, and exactly how it was transmitted, and that we were not putting anybody else at risk by being around them. So we didn't say anything to our friends or to our families for a while because we were so afraid. What was happening at that time was a lot of discrimination as well. People with HIV or who were perceived to possibly have HIV were losing their jobs, losing their family and friends, losing their housing. There were lots of things. Sometimes doctors and nurses who wouldn't treat them. Sometimes communities of faith that stopped welcoming them. So we kept it to ourselves. Finally, that was too much, and we told a few friends, and luckily they reacted well. But I wanted to find a support group because I was feeling like I was the only woman on the face of and certainly in our area, who had HIV. And so I remember I called up Seattle AIDS Support Group, and I asked them when the heterosexual support group met, and the nice volunteer said, "The what?" And I said, "The group for people who identify as straight and have HIV or AIDS." And then he said, "Well, we don't have that group." I said, "How about a group for women?" "We don't have that group. But you're welcome to come to any group that we do have." So Bob and I went to a support group. I was the only woman there, and we made very good friends. Unfortunately, I'm the only person who's still alive from that group, and that's the way the disease went in those early days of the epidemic. Bob finally did get an opportunistic infection, and this was before there were medications to fight HIV, and so he went down kind of that series of steps of losing CD4 cells, and eventually died in '89. His very large Italian family from the East Coast, where they all kind of still live, decided it should be a family secret, that they would not tell family or friends that he had died of AIDS. So it is, and 20 some odd years later, it's still a secret. My mother-in-law still reminds me. So that's kind of the stigma that still exists. My own CD4 cell count was going down, and when Bob died in '89, I was very glad that he was able to die at home. He had had some very excellent care and treatment in hospitals and very compassionate care, and he had also had some care that was not quite so compassionate, and sometimes downright ignorant. But he wanted to be able to die at home, and I was honored to be with him when that happened. I think it's an honor to be with people when they come into the world or when they leave it. So after his death probably was the hardest time for me. I was very depressed, and depression is not very good on an immune system. And it was just a time of a lot of sadness for me. And I feel like I kind of missed out on my 30s because, well, other peers of the same age who were not part of my HIV life were going to weddings, and they were going to christenings and having babies and taking their kids for their first day in kindergarten. I was going to memorial services, and I was going to funerals, and I was sitting at people's bedsides while they were sick and dying of AIDS. So I felt like that was kind of a chapter that I missed. We had decided we obviously decided not to have children, so I have no kids. And that's because at that time, there was still the thinking that you would have about a 50% risk of transmitting HIV to an unborn child, which we now know is a way overestimation. Without treatment, it's more like a 25% risk. But with treatment, and this is really, really, really important to hear, it's only a 1% to 2% risk for an HIV-positive woman to transmit to her unborn child. So although that's too late for me, as I meet other women with HIV, they are finding out that they can actually plan families. And since we have medications available now, they're going to be around to see their kids grow up.